Hi, let's do report and handoff today. So, report and handoff is not as brief as you know it, it's not as brief as you're used to, it's more detailed. Understandably, it has to do with the nurse to patient ratio. Back home, the nurse to patient ratio is not at all the same as it is here. We'll talk about that in a separate video. So the reports you give or take from another nurse at the end of the shift, it's largely dependent on the patient ratio. Now, in nursing homes where you can have one nurse to 10, 15, 20 patients, it's brief. It's more brief than in maybe an LTAC where you get 1 to 4 patients or 1 to 5 patients. And it's even more detailed in the ICU. It is crazy detailed in the ICU when you have 1 to 1 or 1 to 2 patients. So having got that out of the way, let me talk about just the general thing you should expect when giving reports and when taking reports or handing off a patient. So you have to talk about pertinent information about the patient's name, the patient's age, the patient's sex, why the patient is there. The patient's code status, very important. The patient code status. Does the patient want to be resuscitated? Does the patient want a portion of the resuscitative exercises? Does the patient want full code? So that is one thing you should put in consideration. Now, because of you have to go through the systems, you have to talk about what you did for the patient, you have to talk about so many things. So because of that, I recommend you use a sheet of paper. Some people like to write it down on a plain sheet of paper. That's okay. And then some other people use what they call the brain. It's just like a form. It has a name. It has a place where it will put name. Then you put the patient's name, age. So it's like filling out a form. So that's the one I use, and I recommend that because it helps you to catch most of the information you need. And when you are getting reports from another nurse, if they miss anything, all you have to do is look at that paper and see a blank space, and then you ask questions about that rather than just writing it on a plain sheet of paper. Whatever the person says, you write it down. You might miss 1 or 2 things. So the brain looks like this. It's something I know it will be hard to see, but I'll just run through what is on here. This is not as detailed as this one. See, this one is more detailed. So essentially what is on the sheet is just like I said, pertinent information, the patient's name, age, code, the patient's allergies. Is the patient on isolation or not? You put that down. Past medical history. Then you take a brief information about neurological status of the patient. Is the patient alert? Is he oriented? By how much? Ambulation. Can the patient move? Does the patient need help moving? Respiration. Is the patient on oxygen? Is the patient on room air? If he's on oxygen, how much? What kind of oxygen? Is it nasal cannula? Is it the non-rebreather? What is he on? Is he on the ventilator? Then the cardiac. Is the patient on, what's the patient's saturation? Is the patient on telemetry? Does the patient have edema? Is the patient attached to any hemodynamic monitoring device? Then you go to food. What is the patient MPO? Does he have a diet? If he does, what kind of diet is it? Does the patient has a PEG? Does he has nasogastric tube or any other tube that has to do with the GI system? Does the patient have a Foley? Does the patient have colostomy? So many things. The skin, is the skin looking good? Does the patient have IV access? If he does, how many? What's the gauge? And then labs. Is the patient having any labs, pertinent lab coming up? Is there anything that sticks out in the patient's lab I should know? Vital signs. Is there anything I should know? So that's just the summary of the whole thing. You give information. So you see that it's a lot. So it's better you get something like this where you can fill it out. If you are the type that needs a sheet of paper to do it, fine. So just to avoid this video becoming unnecessarily long, I want to point out two things when you are getting report. Whatever the nurse tells you, double check it. Some people may give you a wrong information, an old information, wrong or old. Double check and correct it. Especially beware of people who give report from the top of their head. They'll just give you the report. They may forget something, so double check. Another thing is that you have to upgrade your note-taking skills. You have to pay attention. You have to write quickly. If you have any questions, ask. If the person says anything that is not clear, clarify. Thanks for listening. See you in the next video. Make sure to like, share, subscribe, and follow for more.